So the therapeutic revolution of the heart failure is changed fast. The evolution of the disease and the revolution of the treatment strategy is from golden triangle to fantastic four. So this topic is how to realize the fantastic four.
Professor Hamdani, the fantastic four, ANI, SGLT2I, beta blocker, MRA, has revolutionized heart failure management. From traditional intraop and diuretic to today's corticosteroid therapy. What is the insight of heavy-size shift? Has our view of heart failure evolved from an irreversible progressive disease to a potentially reversible condition?
That's a good question from irreversible progressive disease to potential reversible condition. That is depending, of course, of the phenotype and the cause of the heart failure. I mean, if you look generally at the HFrEF, the heart failure with reduced ejection fraction, we have a better therapy than with heart failure with preserved ejection fraction. Also, the morbidity and the mortality have been reduced over the last 15 years in HFrEF patients. Though with HFpEF, we come up recently with only two specific therapies, and that is the SGLT2 inhibitor and GLP-1 receptor agonist when it comes to obese patients. So we are not yet there. We still have a higher mortality in all the phenotypes. We are probably just reducing the mortality in HFrEF patients, but still not really there with the HFpEF patients. So we still need to do a lot in order to come up at that stage where we have less mortality and morbidity in HFpEF patients.
Okay, thank you for your insight.
So this question is to Professor Liang. And compared to Europe, China has a large HFpEF population. So with unique clinical features, compared with Europe, how has the adoption of the Fantastic Four evolved in China? And why has HFpEF become key priority in our national prevention strategy?
Yeah, okay. I guess maybe almost 50% heart failure is a HFpEF. But the HFpEF, we take the Fantastic Four with ANI and SGLT2 inhibitor, maybe the first choice. But in China, we all know this also have a Chinese medicine. Do a Chinese medicine to treat HFpEF patient. And yes, it's just OCC 2025. We have do this trial. I think maybe in China, in the Chinese medicine, maybe they improve the my circulation in the heart. So maybe it improve this patients, and give I think the good result in the future.
东方问道。